Good evening and welcome to another edition of the Better Care Forum. I'm Tom Harrell and tonight's theme is how people with severe disabilities can live in their communities. We are fortunate to have with us three guests tonight. We have Marie Jobling, co-chair of the San Francisco Long-Term Care Coordinating Council. Welcome, Marie.
Thank you.
We have Paul Dunn, a training specialist for the San Francisco IHSS Public Authority. Welcome, Paul.
Pleasure to be here.
And we have Luis Calderon, project coordinator for the San Francisco IHSS Public Authority. Welcome, Luis, and thank you for being here.
Thank you.
In previous episodes, we've talked about the importance of caregivers in allowing people with disabilities to live independently. Marie, I'm wondering what can be done to further allow the independence movement, so to speak, to continue and grow with increased professionalization of the caregiver community?
Well, I think there's some lessons from the way the movement here in San Francisco has gone. When I first convened the IHSS task force in San Francisco about 16 years ago, we knew at that point that home care workers made the difference for 4,000 seniors and people with disabilities here. Without them, they would not be able to remain in their home. But they were getting paid $4.25 an hour and with no benefits. So it was pretty clear that if we wanted to improve things for folks, and we would need to deal with wages and benefits as the first priority. And so over these last 15, 16 years, the wages have gone from $4.25 to now $10.65 an hour, and we've added health benefits. This is largely because the community has worked together. But that's a start.
Yeah, well, that's a good start.
Yeah.
And in addition to benefits and earnings, are there other kinds of improvements that have been made for the caregivers in the last 15, 16 years?
I think training is another important component here. Clearly, this is an arena where folks need skills, and they need training not only about how to do their job safely, but it requires a great deal of interpersonal skills to be able to be a successful home care worker and provide the kinds of services that people need. So training has been another clear priority.
And Luis, I'm curious, what kind of training program has the IHSS instituted in San Francisco?
Right, so over the last 10 years as the public authority was created, we saw the need that more and more people were going home from hospitals or living in the community with chronic conditions or with higher needs. So the level of the skills of the workforce had to improve. So over the years, it was really a struggle to find the right training components and right training and just funding actually for this workforce. Luckily, a couple of years ago, we had some funding to begin a training program. So we started a training program that would address the needs of just basic home care skills training to now more advanced training that would meet the needs of consumers going home with a Hoyer lift, all kinds of medical equipment, and just being able to prepare the workforce to meet those needs in the consumer's home, especially with the growth of people being discharged from the hospitals earlier or faster with these conditions.
Sure.
It was important to prepare this workforce to do that, and the workforce needed to know from the very basics to the more intense, and that's why we hire Paul, actually.
Okay. Oh, Paul, is there a set curriculum for, let's say, a novice person coming in to be a caregiver that they need to learn?
Well, what we've done is we've put together two components of the training program. The first is a basic component that basically I try to instill in people a little bit more self-confidence in themselves and their ability to provide those needed skills. We go over things as basic as first aid and CPR, but then we take it a little bit farther by training them also to do CPR in a bed or to handle an emergency in a wheelchair for a person. Because of the diversity of our consumers, we have a real important component called cultural competence.
Okay.
And basically what that does is that teaches them to go out and be able to communicate with people with different culture, cultural backgrounds. English may not be the first language, and if it's the second, it may not be that well spoken. So they need to have special skills on how to not be stuck into their own cultural groove and neglect the needs of other cultures. So that's a real important component of it, and that's a real basic one.
To what extent do the consumers have input into the training of potential caregivers or ongoing training of existing caregivers?
Well, the public authority has an advisory board that is a majority consumers. Mm-hmm. And that board has always led the way in terms of the direction of the services the public authority can provide, including to how the registry works and how our emergency program works and now how our training component works. They have given us input in terms of what is important for consumers, and that's why we teach culture competency and other things like that, but also to give choice to consumers. Consumers in their homes are going to be the ultimate trainers.
Sure.
Yet they want to have a prepared workforce that can do at least the basics and have some knowledge about how to take care of someone. The day-to-day is an individual choice by consumers that they need to make their own choices and who's the worker and how they want the things done. So.
Sure. Marie, perhaps you could explain a little bit about what the registry is for the public authority and how a consumer can exercise his or her choice amongst people on the registry.
I think the dilemma in the old days was, if you needed a home care worker, how would you find one? And especially, how would you find one who spoke your language, had the same ability was interested in the same kinds of things you were, and so forth, who could do the job. And the registry really provides a way for workers and consumers to find each other. So there is a group of workers who've been pre-screened and whose information is available, and consumers then can call up and can request names of providers who they can then interview and try to make the good match, sort of a matchmaking service.
Okay. So does the public authority, to what extent does the public authority, are you kind of a neutral then, I guess, broker, if you will, of services to consumer? Or is there more active, how active a role do you take in trying to match people who may be compatible?
Well, I think the public authority takes a significant role, right?
Right. The public authority does a central role in our registry. What it does is recruits workers, gathers their basic information, does some screening of them. We check references, we maintain their information up to date. And then when a consumer is in need and they call and they ask for assistance, we ask information of what are their needs. If they want someone in the morning, what kind of tasks they want, personal or household care, what language do they speak, neighborhoods, all the way to if they smoke or they have cats or dogs or anything like that. So we use that information with a database system that can print a list of names of workers that best meet the needs of the consumer. Mm-hmm. Then the consumer can call those workers, interview them, and decide who they want to hire. And that's the importance of giving choice to consumers. Sure. That way they have the choice to hire someone that comes into their own homes.
In addition to wages and benefits and training, is there anything further that the IHSS Public Authority here is working on to try to make caregiving a more attractive profession for people or to improve the matching process? I'm curious kind of what ongoing efforts are being made or contemplated.
Well, training is a big component that we try to expand. This is fairly new in the last 18 months or so to a couple of years, but we try to expand our emergency services to provide backup services, and that's incredibly has grown significantly in the last few months, especially where we assist people where they don't have a worker, or their worker is out sick, or where simply they're being discharged without a worker, or when they're just applying for IHSS services and they're waiting for the process to go through and they are in the community. And in the past, people would go being discharged from the hospital and literally struggle for weeks or months at a time before even a social worker and even a home care worker can come in and be paid by the state. Mm-hmm. Nowadays, people can call even from the hospital. A social worker can be at the hospital, make an initial assessment, and immediately go home with an emergency home care worker. This emergency home care worker, our on-call workers, are the ones that have the most experience and the more advanced training, so they can be prepared to meet whatever things happen. And there are situations where, from the very basic to the very advanced, where people need all kinds of personal care, all kinds of use of different equipment, and they have to do it immediately without getting to know the consumer or any training, so they have to have that experience.
Well, you alluded to how the care workers are paid. I'm curious, does the public authority pay a caregiver directly, or do they give the money to the consumer to then pay the care? How does that system work?
Well, the IHSS is still a state program, so it's run by each county. The county still administers the timesheets, but ultimately the check comes from the state of California directly to the worker. But the consumer remains the employer for the purpose of hiring and supervising that worker.
Okay, and are there other funding sources besides the state that could be tapped to expand the program, or what can people do who are interested in helping this program grow and continue to help?
I think in San Francisco there's been a real focus on trying to get the county, for example, to buy into and help develop some small pilot projects that both expand who is served by home care, but also looking at issues like ombudsman and outreach. How do you really make sure that you get consumers who most need the services to be able to use them? If you create this system, which really has a trained and supported workforce, how do you make that available to a wider group of people? So the county is one place. I think other things people have looked at is how do you get the federal government and the state government to put more resources into home care and community-based services.
Okay. Well, thank you for joining us for this segment of the Better Care Forum. Please stay with us for further discussion of these important issues. And that was the conclusion of our first. Welcome back to the Better Care Forum discussion. Our guests Marie and Luis are still with us, and we've been joined by a new guest, Donna Kalame, the Executive Director of the San Francisco IHSS Public Authority. Donna, thank you for joining us.
Happy to be here.
And I wanted to continue a little bit with some of the issues we were discussing earlier, and in particular, the importance of post-discharge in-home supportive services, so that when someone leaves a hospital or perhaps a nursing home, they know that right away they have the kind of support services we were describing earlier. I'm curious how that came about and how that's evolving.
Before the creation of the public authority, there was no means to provide those type of services. Our board saw that there was a need to provide emergency care for consumers that went without services for a while. And that happened because our consumers in our board, they themselves saw themselves in need of these services. So out of that, there was the creation of our on-call program. Our on-call program serves people that need services for personal care when their home care worker is sick, or when they're out, or when they don't have a worker. And out of the community a few years ago, there was a push to improve the way people were discharged from the community. Okay. And that really sparked the growth of the on-call program.
Mm-hmm. And is that the same registry we talked about earlier, or is there a different set of workers who may be on call or specialize in post-discharge and home support services, or is it a general caregiver population?
They are people on our registry, but our registry is, as Luis and others have described, when a person hires a regular independent provider through the regular program, they are the consumer that interviews, hires, fires. Because of the way the on-call program works, those are people who are both independent providers, and then they are employees of the public authority for purposes of on-call work. Okay. So they sort of serve a dual role at that point.
So it sounds as though there may be a slight bridge if someone is discharged or needs someone, let's say for a week because their caregiver is on vacation. There may not be time to make the typical consumer choice where you get to interview someone, but you have qualified people on call, I guess, who then can step into the breach